7 Silent Symptoms of Kidney Disease. Welcome to Health Talk 366, your trusted destination for daily health facts, science-backed explanations, and life-saving wellness insights. Today's topic is one that could make a major difference in your long-term health, kidney disease, and the silent symptoms that often go unnoticed. The kidneys are your body's natural filtration system. They remove toxins, regulate fluid balance, and help control blood pressure and red blood cell production. But here's the frightening truth. Kidney disease often develops in silence. Many people don't realize their kidneys are under stress until significant damage has already occurred. That's why learning to recognize the early, subtle, and silent symptoms is so critical. In this video, we'll uncover 7 silent signs your kidneys may be struggling. Symptoms that can easily be mistaken for other conditions or even dismissed entirely. We'll explain the science behind each one, why it happens, and what to do if you notice it. If you or someone you know is at risk due to high blood pressure, diabetes, or family history, this information could help catch kidney disease before it's too late. Let's dive in. Symptom 1. Fatigue and weakness. One of the first and most overlooked signs of kidney dysfunction is chronic fatigue. People often think it's due to aging, lack of sleep, stress, or work, but in many cases, it's your kidneys struggling to filter waste effectively. As kidney function declines, waste and toxins build up in the blood. This leads to a condition called uremia, which can make you feel tired, weak, and mentally foggy. But there's another reason for the fatigue. Your kidneys help produce a hormone called erythropoietin, EPO, which tells your body to make red blood cells. When EPO production drops, fewer red blood cells are made, leading to anemia, a common cause of fatigue, shortness of breath, and pale skin in people with kidney disease. If you find yourself needing more naps, dragging through your day, or unable to recover energy with rest, and especially if you have other risk factors, it's time to look deeper. Symptom 2. Changes. In urination, your urine is one of the first places silent kidney problems show up. But many people ignore the signs or chalk them up to hydration changes. Watch for these changes. Foamy or bubbly urine, a sign of protein leakage, dark, orange, or tea-colored urine, possible blood or concentrated waste, frequent urination, especially at night, nocturia, painful urination, or a burning sensation, sudden changes in volume, either too much or very little. The kidneys regulate fluid balance and filter waste into urine. If they're struggling, the urine changes to reflect that. While occasional variation is normal, consistent or extreme changes should not be ignored. Symptom 3. Swelling in the legs, ankles, or hands. When kidneys can't remove excess salt and fluid from the body efficiently, it begins to accumulate, especially in the lower extremities. This leads to edema, or swelling, most commonly in the feet, ankles, legs, and hands. You may notice your shoes feel tighter, your socks leave deep marks, or rings no longer fit. Swelling that worsens by evening or after long periods of standing is particularly concerning. This isn't just cosmetic. Edema is a sign that your body's filtration and drainage system is compromised. Over time, it places added strain on the heart and blood vessels, compounding the risks. Symptom 4. Persistent puffiness around the eyes. While many people associate eye puffiness with poor sleep, allergies, or aging, consistent morning puffiness around the eyes can actually be an early sign of protein leakage through the kidneys, especially albumin, a critical blood protein. Healthy kidneys keep protein in the bloodstream, but damaged filters, glomeruli, allow protein to escape into urine. That loss of protein contributes to water imbalance and causes swelling in soft tissues like the eyelids. If your eyes are puffy, even when you sleep well and stay hydrated, and especially if you also notice foamy urine, it's time to ask your doctor about a urinalysis and kidney panel. Symptom 5. Itchy or dry skin, 2,500. The skin is often overlooked as a symptom of kidney dysfunction, but it can reveal a lot. Kidneys help maintain mineral and fluid balance, and they also remove waste. When this system falters, toxins build up, and the skin suffers. People with early or moderate kidney issues often report dry, flaky skin, persistent itching, pruritus, ashen, or yellowish skin tone. Irritated patches that don't respond to lotion itching is thought to result from a buildup of urea and other waste products beneath the skin's surface. These toxins irritate the nerves and create an unrelenting urge to scratch, often worse at night. Symptom 6. Metallic taste in mouth and ammonia breath. A strange metallic taste in the mouth, bad breath that smells like ammonia or urine, or a loss of interest in food can all be signs of advancing kidney dysfunction. When the kidneys can't filter urea and nitrogen effectively, these waste products circulate in the blood and can be excreted through saliva and breath. This not only affects taste and smell, but also appetite and nutritional status. People may report weight loss, food aversions, especially to protein, nausea, and even vomiting, all of which can accelerate the decline of kidney and overall health. If your breath smells different, or you've lost your love of food without explanation, it's a red flag worth addressing. Symptom 7. Shortness of breath or chest tightness. Shortness of breath isn't just a lung or heart issue. When kidneys fail to remove extra fluid, it can accumulate in the lungs, a condition called pulmonary edema. This can make simple tasks, like climbing stairs, walking uphill, or lying flat, suddenly difficult. The person may feel like they can't get enough air, or wake up at night gasping for breath. Additionally, anemia from kidney disease reduces oxygen carrying capacity of the blood, which makes breathing harder during physical exertion. Pain. Your breathing changes without clear reason, and especially if you have other symptoms from this list. A kidney workup is warranted. Conclusion and next steps. Kidney disease is called a silent killer for a reason. Most people don't know anything is wrong until 60–70% of kidney function is already lost. That's why learning these subtle signs and acting early is so critical. Let's recap the 7 silent symptoms: fatigue and weakness, changes in urination swelling. In extremities, puffiness around the eyes, dry and itchy skin, metallic taste, or ammonia breath, shortness of breath. What should you do next?
Schedule a blood and urine test. Look for eGFR, creatinine, BUN, albumin, and urine protein. Track your symptoms and share with your doctor. Stay hydrated, but avoid excess salt. Manage blood pressure and blood sugar. Eat kidney-friendly foods. Berries,
Garlic, olive oil, cauliflower, and fish rich in omega-3. Avoid NSAIDs and unnecessary medications that strain the kidneys. Remember, kidney disease is manageable and even reversible in early stages if caught in time. You don't need to wait for a crisis. Your body is speaking. Learn to listen. Thank you for watching Health Talk 366. If this video helped you, please like, share, and subscribe. Someone you love could be silently suffering, and this knowledge could change their life.